Welcome to the American Heart Association's Product Orientation for 2011 BLS for Healthcare Providers course materials. Before we get started, take a quick look at your screen to locate the Windows Media Player operating buttons. The Media Player operating buttons, usually located at the bottom of your screen, will let you pause, stop, and restart the presentation. To pause the presentation, simply click on the button with the two vertical bars. To restart, click on the same button. To stop, click the button with the square icon, and then click the same button to restart from the beginning. To move back or jump ahead, click and drag the bubble on the horizontal green bar directly below the presentation. This orientation will be most beneficial to you if you have the new materials in front of you while we review the information. You may want to hit pause now to set up your materials if you haven't already. Okay. Let's move on to the BLS for Healthcare Providers Product Orientation for American Heart Association BLS instructors. To begin, we want you to keep in mind that this BLS for Healthcare Providers Product Orientation is different and separate from the 2010 AHA Guidelines Instructor Update. The Guidelines Instructor Update specifically addresses changes to CPR and ECC science. And remember, if you haven't already completed a 2010 Guidelines Update, the American Heart Association requires all instructors to do so by April 1, 2011. Completing the Guidelines Update does not renew your instructor status. For renewals, contact your training center coordinator. As you use the materials and teach the course, you may find you need clarification on elements of science that are new or changed. If so, refer to the highlights of the 2010 AHA Guidelines for CPR and ECC. This resource is also referenced on page 32 of your instructor manual. The Guidelines, Highlights, and the Guidelines Update are both available on the AHA Instructor website at www.ahainstructornetwork.org. Go to the News tab and choose Guidelines. AHA created this product orientation to help you better understand the BLS for Healthcare Providers product changes and help you use the new materials. This orientation will give you information about the new course materials, course curriculum updates, and how these changes affect teaching the course. The new BLS for Healthcare Providers course materials and all upcoming new course materials have a revised look featuring a new graphic design. Here you see the covers use distinct anatomical artwork. The BLS materials are again blue, but inside the manuals you'll see light green as a secondary color. And all new products based on the 2010 AHA Guidelines for CPR and ECC, from manuals to DVDs to course completion cards, have new product numbers. The numbers for products based on the 2010 Guidelines begin with the prefix 90. So, for example, the new BLS Instructor Package is product number 90-1037. First, let's look at the new BLS for Healthcare Providers Instructor materials. All the materials you need to teach the course are included in the instructor package. The package includes your new instructor manual and a new student manual. We'll look closer at the manuals in a minute. Also included in the package is the course DVD. It has video lessons for teaching both the full course and the renewal course. These course video lessons are available only in DVD format. The new DVD is 129 minutes total and is available for purchase separately. As in the past, the instructor package includes an AHA stopwatch for skills practice and testing. Your new instructor manual has 5 parts. Part 1 is preparing for the course. Part 2 contains details for teaching the course. Part 3 is testing and remediation. And Part 4 is additional resources. Part 4 has information on AHA's BLS self-directed learning courses, which are BLS for Healthcare Providers Online and HeartCode BLS. You'll also find Part 4 has additional information of interest to instructors. Part 5 is the lesson maps. Let's take a look at the lesson maps. The instructor manual comes with lesson maps for both initial and renewal courses. Overall, the lesson maps have not changed in design or concept and remain important to use in the classroom. The new BLS lesson maps contain critical concepts information, making it easier for you to point out to students at the appropriate times. The instructor manual also holds the BLS for Healthcare Providers Instructor CD. The CD contains many files for your use, such as skills testing sheets, the lesson maps, an equipment list, a sample pre-course letter, a list of video chapters with corresponding lesson maps, AHA websites for instructors, a healthcare provider summary of CPR steps, and an instructor candidate application. In response to customer feedback, the instructor manual now includes 6 tabbed divider pages. The dividers were designed to help you organize materials and make using the manual easier. The dividers separate the various sections of the manual, and each has a meaningful text label, such as Teaching the Course. Now let's look at the student materials. The new BLS for Healthcare Providers student manual has the same look as the instructor manual. The manual is again in full color with illustrations. The student manual even includes the skills testing sheet so students can review expectations in advance. As in the past, the manual is a student reference tool. Be sure your students have their copy to read and review before the course, and remind them to refer to it during the course, and continue to use it as a reference tool after the course. The student manual includes another ongoing reference for students, a new item, the Pocket Reference Card. The new Pocket Reference Card has 6 panels of information. The first panel highlights the new CAB sequence. Other panels include critical concepts in high-quality CPR, the adult BLS algorithms, and the pediatric BLS algorithms. Much like the Pocket Reference Cards for ACLS, PALS, and PAIRS, this quick reference tool is designed to be handy with its easy-to-reach pocket size shape. The Pocket Reference Card is not sold separately at this time. The Healthcare Provider Course Completion Card and the BLS Instructor Card also feature a new updated look. The revised cards use the new AHA logo, and the red bar on the left edge used on the former card has been removed. The blue product color bar is at the top edge as before. To help prevent card fraud, the security microprint embedded in the data lines is enhanced. Now, the microprint is unique for each type of card. The new microprint is the title of the course, in all caps with no spaces. Healthcare Provider, as one word, is the microprint used on the Healthcare Provider cards. On the back of the card, there is space added to fill in the Training Center ID number and Instructor ID number. What is your Instructor ID number? And where do you get one? An ID number is generated on the AHA Instructor Network website when you create your profile. If you've already created your profile, you will see your ID number when you log in to the website. If you need help getting a number, contact your Training Center coordinator. All cards still come on 8.5 by 11 sheets, and all are the peel and fold format. A revised merged document template used to appropriately fill in the data fields will be available to Training Center coordinators on the Instructor Network website in late March 2011 when the course becomes available for purchase. The Instructor card uses the same new graphic features as the Healthcare Provider card. Additionally, as you can see on the front of the card, the certification statement is abbreviated. The security microprint is also enhanced for instructor cards and uses the course title in all caps, no spaces, BLS Instructor in this case. On the back of the card, space was added to include the Training Center ID number. And the course location data field was removed and replaced with a space to fill in the Instructor ID number. A revised merged document template used to fill in the data fields will be available to Training Center coordinators on the Instructor Network website in late March 2011 when the course is available for purchase. When you're issued the new card at your renewal, the card will have your name on the front and your ID number on the back. Current BLS instructors with valid cards do not need to have this new instructor card until they renew. Let's review updates to the BLS for Healthcare Providers curriculum. What's important for you to know is that the new science updates are included in the video lessons on the course DVD. This will help you convey key science changes to students and do so with a consistent delivery method. Looking closer at the course, you'll see a focus on learning objectives. To successfully complete the BLS for Healthcare Providers course, students must understand the 6 key learning objectives, which are outlined on page 1 of the student manual and pages 1 and 2 of your instructor manual. You will see that the learning objectives apply the 2010 guidelines. including the CAB sequence, along with essential details such as compression rate and depths and compression to ventilation ratios needed to achieve high-quality CPR. The overall curriculum, as well as the learning objectives, incorporate critical concepts that students must learn and understand. The curriculum continually ties to the critical concepts of high-quality CPR. Students should understand that high-quality CPR isn't simply a number of compressions. It's about how they perform all the critical steps correctly. Critical concepts of high-quality CPR are boldly presented for students, as you see here on page 2 of the student manual. You'll also see the critical concepts incorporated into the key instructional tools. This means you'll see the critical concepts in course video lessons on the DVD, in the manual, in the new written test, and on the skills testing sheets. Let's cover some updates to instructing the course. As before, you will continue to use key instructional tools to deliver the course. You'll find this includes lesson maps, your instructor manual, the instructor CD with all necessary forms and checklists, and the course DVD with video lessons. Look to Part 2 of your instructor manual for instructions on using lesson maps, the icon definitions, and a complete course outline. Part 2 starts on page 11 in your manual. Based on results from new product pilot sessions, the full course will take approximately 4.5 hours to complete in the classroom, with a ratio of 6 students to 1 instructor to 2 mannequins. The time to complete the renewal course is also based on pilots. With inclusion of new science, it is estimated to take 4 hours. This allows enough time for practice and remediation for providers who do not perform CPR regularly. Watch the Instructor Network for product updates, new tools, and course tips. The AHA will continually develop best practices to help you enhance delivery of courses. In the new materials, you'll find that the lesson map titles are closely matched to the DVD video titles to help you navigate through the lessons. Remember, the lesson maps have not changed in concept, and they remain important to use during class. And again, as you use the lesson maps, you'll see that the lessons are tied to the critical concepts to help ensure that students learn to perform high-quality CPR. Skills testing has been revised to reflect the 2010 guidelines. And again, the new skills testing criteria are tied to the critical concepts to ensure students are observed and evaluated on performing high-quality CPR. So, you can expect significant changes in the steps that are to be conducted for skills testing. Part 3 of your instructor manual, starting on page 21, gives instructions for conducting skills testing along with the new skills testing sheets. What you will notice first is that 2 skills testing sheets are provided, one for testing adult BLS and AED skills, and another for testing infant BLS skills. The skills testing sheets are included in both the instructor and student manuals so that students can prepare and review in advance and know what to expect during skills sessions. When you use the new skills testing criteria sheets, you will also notice that child BLS skills are not tested as in 2005. Child is defined as age 1 to puberty. And remember, there are differences in adult and child BLS. The differences are presented in Lesson 16, where you will deliver the information that is discussed in the video lesson, Introduction to Child BLS. Additionally, the specifics of child BLS are presented in Part 4 of the student manual on page 29, specifically when to activate the emergency response system. Both the adult and infant skills testing sheets include new content. The new skills testing sheets include a page with skills testing criteria and descriptors. These pages can serve as remediation tools to help both instructors and students. The skills testing criteria and critical concept sheets are also in both the instructor manual and the student manual. Now let's look closer at each sheet. The new adult skills testing sheet has 9 skill steps, whereas the former included 10 to 12. And you'll see that with the new guidelines to initiate compression sooner, the assessment step is no longer taught with look, listen, and feel for breathing. This step was removed because bystanders often fail to start CPR when they observed agonal gasping. The healthcare provider should check the victim for 2 things simultaneously: response and breathing. Another major change to the skills testing is Step 4, gives high-quality CPR. Step 4 requires testing on 5 cycles of CPR and a 30 compressions to 2 breaths ratio, with a different component observed and evaluated in each cycle. In Cycle 1, you will evaluate hand placement. In Cycle 2, you will evaluate rate. Cycle 3 is evaluation of adequate depth. In Cycle 4, you will observe the student on allowing for complete chest recoil. In Cycle 5, you evaluate that there are minimal interruptions and compressions while giving breaths. After 5 cycles of CPR are completed in Step 4, a second rescuer arrives, and the testing transitions to 2 rescuer CPR and AED skills in Steps 5 through 8. Then in Step 9, the final step, you will evaluate the first rescuer's ability to provide bag mask ventilation. Again, the goal is for students to learn and perform each requirement according to the skills testing sheets, and you will use the sheets to validate students' skills. The new infant skills testing sheets has 7 skill steps, whereas the former included 14. As with the adult skills testing sheet, look, listen, and feel is removed from the assessment step, and providers should check the victim for 2 things simultaneously: response and breathing. The healthcare provider should not delay sending someone to activate the emergency response system. Additionally, the specifics for infant BLS are presented in Part 4 of the student manual on page 33, specifically when to activate the emergency response system. As with adult skills testing, Step 4 gives high-quality CPR, requires testing on 5 components of performing CPR, 1 in each cycle. You will observe and evaluate finger placement in Cycle 1. In Cycle 2, you will evaluate rate. Cycle 3 is evaluation of adequate depth. During Cycle 4, you observe students on allowing for complete chest recoil. In Cycle 5, you evaluate that there are minimal interruptions and compressions while giving breaths. After completing 5 cycles in Step 4, a second rescuer arrives, and the testing transitions to 2 rescuer CPR. Then evaluate the 2 thumbs encircling hands technique in Steps 5 through 7, which is now tested. In Step 7, the final step, the rescuers switch roles so you can complete the evaluations of the same skills with students in a different rescuer role. You will also see in the course lessons that the placement of one hand on an infant's head is no longer recommended. The action was removed and is no longer a part of infant CPR. The video lessons reflect this change. Again, the goal is for students to learn and perform each requirement according to the skills testing sheets, while you use the sheets to validate students' skills. The written test is also revised to reflect 2010 guideline science and changes to the curriculum. All instructors must take the test to become familiar with the content. The revised test includes 25 questions rather than 20 as in the former test. There are still 2 test versions. Both the classroom-based and e-learning courses use the same test content. To improve test security, save paper, and reduce the amount of materials for instructors on the new test, there are no detailed annotated answer sheets. Instead, questions are simply referenced back to the relevant pages in the student manual. As before, you can obtain a master written test and answer key from your training center coordinator once the course is available for purchase. Keep in mind that a standard test is developed to ensure that all students are evaluated on the same required content. The AHA does not allow alterations to any tests and requires instructors to use the test as is. As always, you should treat all AHA tests as secured. AHA offers web-based e-learning courses including BLS for Healthcare Providers Online Part 1 and HeartCode BLS Part 1. These courses are being revised to reflect the 2010 guidelines and will be released this year. Upon release, the new course information will be sent to training center coordinators and posted on the instructor network. AHA instructors will continue their integral role in conducting skills, practice, and testing sessions for AHA e-learning students. As with the classroom-based course, instructors will use the revised skills testing sheets. You can find information about the instructor's role in e-learning courses skills testing on page 31 of your instructor manual. And until new e-learning courses that include new science are released, e-learning students will be directed to an informational page with resources for the new science and the interim skills testing sheets. You should be prepared to discuss new science updates with these students prior to practice and testing. For details, refer to the March 1, 2011 training memo adding 2010 guidelines to AHA e-learning programs and skills practice and testing. It's available on the AHA Instructor Network. After students complete a course, AHA requires instructors to collect a course evaluation form from all students. The course evaluation form should be used for all AHA courses. The Instructor Network is your resource to get the most current and updated forms, such as course rosters, equipment lists, and evaluation forms. It's an exciting time as AHA instructors deliver training with new life-saving information. As this course and others become available, please remember that your first and best resource as an instructor is your Training Center coordinator. Your Training Center faculty is another valuable resource. And the Instructor Network website is the key place to find updates and information about products, AHA activities, course forms, and more. Watch the Instructor Network for release of new Heart Saver courses, BLS product updates, new tools and course tips. The AHA will continue to develop best practices to help you enhance delivery of AHA courses. This concludes the BLS for Healthcare Providers Product Orientation. The American Heart Association would like to thank you for viewing this session.